Ohio laws don't allow for physicians to be involved in medically assisted death. Instead, seriously ill people get care from hospice workers. Christina Massey, Director of Palliative Care and Hospice at Ohio Health's Riverside Methodist Hospital, and Kim Graffis, Administrative Manager, spoke with NBC4 about the process of dying with dignity.
What is a death with dignity in hospice care?
So part of hospice's goal is to be able to, through our interdisciplinary team, get to know patients and their family and really understand what their wishes are, what their preferences are, and what dignity means to them. So to us, dying with dignity is being able to die in the way that somebody wants to die. And that is different for every different person that we come and get to meet.
What are you not allowed to do?
We are not allowed to assist in any sort of suicide or, anything like that. That's obviously illegal here in Ohio. So, sometimes that is a topic of discussion for our patients, depending on their diagnoses. And also shaping that, what is dignity to them? So if patients are used to being very independent and doing everything on their own, and then they have to rely on caregivers, that a lot of times is a discussion because they truly do not want to be a burden to somebody. So the sooner hospice can be involved to help with those discussions, because like Christina said, we have an entire interdisciplinary team.
How are people kept comfortable as they face the end of their lives?
Well, everybody's plan's going to look different. It's really key for the nurses to collaborate with our physicians about what needs to happen. We also have nurse practitioners as well that do majority of home visits for us. So we just need to take a look at the patient as a whole, look at their past history, what have we been giving them, and formulate a plan. And sometimes that simply is, I don't want to die in my home because I have young children, or I do want to die at home, but this is how I would want that to look. So it all goes back to literally from our first visits, shaping the plan of care for the patients and family and making it individual.
It sounds like it's a kind of a wraparound service. It goes around the patient and then wraps around the family too.
It's the first time in your life that you actually have the ability to be in the driver's seat, and everyone else and the healthcare that's providing the healthcare to you is in the back seat.
A lot of times, if we ever hear people who express regrets when it comes to hospice and hospice care, it's that they didn't allow hospice to come in sooner. There's a lot of fear around hospice or the conversation of dying. But people often will say once they get into hospice, oh, I just wish we would have done this sooner. I wish I knew about this sooner.
I'm Local for You in Columbus, Cynthia Rozzi on NBC4i.com.